जी हम कढ़ाई से लौटाए हैं।
This is Mudassir Ayaz Khan, ABM Jabalpur. A very good evening to all the eminent doctors. Thank you so much for joining us at today's webinar. Our endeavor is to spread awareness about rabies, which can be fatal, but which can be avoided once appropriately vaccinated. This is an initiative from the House of Cadila, who is innovation to serve the society and humankind.
जो तुम बता रहे थे ना
Today's webinar
तो उसमें भी
is the
बोला
dosage reduction strategy in rabies management. That is the role of novel vaccine. Dear doctors,
क्या
rabies is the world's first novel 3-dose anti-rabies vaccine, and with a great pride, we would like to inform that it has successfully completed 1 year of launch, with more than 40,000 of the animal bite victims being vaccinated. 100% compliance was recorded, and no case of adverse drug reaction was registered. With this, it is my honor to introduce you today's speaker of today's webinar, that is Dr. Arun Saxena, sir, who is a specialty and MD pediatrician, and he's also serving the humankind for last 25 to 30 years, and has been the members of IMA as well as medical institutions. So I would like to request Dr. Arun Saxena, sir, to initiate the talk, and later on we'll have the question answer session. So it's as a participant, I will ask the other doctors to drop some questions. We'll read out after the presentation. So now handing over the session to respected Dr. Arun Saxena, sir.
Thank you, Mr. Mudassir, and very good evening to all my colleagues, the technical support team. Today, we are going to talk about the most novel 3-dose vaccine, that is rabies of Cadila. Well, before discussing about the vaccine, let us quickly brush up the rabies disease. Dear friends, as you all know, it is one of the most fatal diseases caused by a virus by the bite of a zoonotic animal to the humans. This virus belongs to the Rhabdoviridae family of the order Mononegavirales and Lissavirus genus, and it was first described in the 4th century before Christ. WHO reports that dog bites are responsible for up to 97% of rabies cases, but cats and monkeys have also been known to spread the disease, though it is quite rare. Other animals, that is, those which had terrestrial and even airborne mammals like wolves, foxes, macaws, cats, bobcats, coyotes, lions, mongooses, skunks, badgers, bats, monkeys, they also spread the rabies infection. Animals such as monkeys, jackals, horses, cattle, and rodents seem to bite incidentally on provocation, and fear of rabies leads the victim to seek post-exposure prophylaxis. The number of cases involving monkey bites have been increasing in the recent past, and it has been seen that the monkeys are susceptible to rabies and their bites necessitate post-exposure prophylaxis. Well, regarding the epidemiology, rabies kills 59,000 people globally every year. In India alone, 15 million stray dogs and 25 to 30 million pet dogs have been reported. In 2018, 2,000 human deaths were reported due to rabies, which accounts to 60% of rabies deaths in Asia and 35% globally. It is a very big number. Rabies virus is a neurotopic virus that affects the central nervous system, that the brain. It has got 5 genes. The first gene is nucleoprotein. It is represented as an N. Second is phosphoprotein, P. Third is the matrix protein, M. And fourth is the glycoprotein, G. And fifth is the viral polymerase, represented as L. amongst all five, the G protein is the major antigen in the formation of neutralizing antibodies. Apart from G protein, N proteins also play an important role in imparting immunogenicity against the rabies virus. Categories of contact with suspected rabid animal. Category 1. Let us, before prescribing the treatment, let us discuss about the category. Category 1 is touching or feeding animals or animal licks or intact skin, and there is no exposure directly. Post-exposure prophylaxis. The current, that is, we are discussing about the current management. So we are having category 1. In this, there is hardly any exposure. So just washing of skin surfaces clears the superficial infection, and no post-exposure prophylaxis is required in this case. The category 2 is nibbling of uncovered skin, minor scratches or abrasions without bleeding. That is, there is an exposure. In this post-exposure prophylaxis, we have wound washing as was in the case 1, and immediate vaccination. Vaccination must not be delayed. Category 3. In this, single or multiple transdermal bites or scratches, contaminating of mucous membrane or broken skin with saliva from animal bites, exposure due to direct contact with bats, that is severe exposure. In this, we have, that is, wound washing, PP measures wound washing, immediate vaccination, and administration of rabies immunoglobulins, RIB. Slide presentation. Now, this is the, let us also discuss about the grades of the animal bites. First grade is the, when the animal bites the lower extremities of the body, and the grade 2 is when the animal bites the abdomen or the chest, and the grade 3 bite is when the animal bites the face or the head, because from there the infection traverses the central nervous system very early, and therefore that is the most dangerous grade. Regarding compliance, most of the deaths occur due to non-compliance. Great compliance when the patient receives the full course of anti-rabies vaccine, that is according to the scheduled doses of ARV on the recommended dates. Second is delayed compliance. The person who completes the scheduled dose of ARV in 60 days but deviated from the scheduled dates. And dropout or non-compliance is who had taken at least 1 dose of ARV animal diet after animal bite, but not completed all the scheduled doses. It has been seen in municipal corporation hospitals that most of the patients comply only 60%. Most of their cases have, there is a dropout of 40%. 60% patients, only day 0, 100%, because the victim gets panicky and goes to the hospital or goes to the doctor and gets the first vaccination done. But on the day 3, there is a dropout of 12%. 88 victims go to the doctor. Similarly, on day 7, there is still a dropout, increasing dropout, that becomes 85%. Then 14th day, it becomes 70%. And on 28th day, it becomes 60%. So there is a big dropout, which leads to the death of the victimized person. Constraints for compliance to complete course of anti-rabies vaccine. It is due to the firstly, most of the people forget that they have to go for vaccination of anti-rabies vaccine. Then there is the cost factor, which incurs 13%. Then the distance between the home of the patient and the hospital is 11%. So most of the patients ignore to go to the hospital for vaccination. And then 11% of the children drop out because of the school timings being the same as that of the hospital. Previously, why there was an evolution of rabies vaccine? Previously, we used to have 31 injections of increasing immunogenicity, which is very, very impractical, you can say. And that led to the discovery of. Then there were 14 injections. People used to say that if you are bitten by a dog, you will be having 14 injections in your abdomen, And similarly, dropout used to be of major importance, and therefore now there is 5 injection schedule, which is most practically being done. But still, we are thankful to Cadila for limiting the breaks from 5 to 3 injections. Meeting the unmet medical need, introducing a novel vaccine with simple and shorter regime. Novel 3-dose recombinant rabies G protein vaccine. First protein subunit is subunit vaccine prepared by virus-like particle platform technology. Intramuscular regimen 0, 3, and 7 days, given better compliance due to easy and short regimen. And the victim is completely vaccinated. Native virus G protein is difficult to stabilize. G protein isolation using virus-like particle technology purified and stabilized by Cadila Pharmaceuticals Limited. Virus-like particles are protein complexes. They exist as nanoparticles, very minute particles. They are very, very small particles. Virus-like particles are similar to native virus particles, but that do not contain the viral genome, and therefore less amount of reactions are encountered with this type of vaccine. They cannot replicate. Virus-like particles cannot replicate, but can mimic the viral antigenicity without being pathogenic. They are capable of inducing a strong humoral and cellular immune response. And this is as a result, we have a very strong, very good immunogenic product in form of Thravis, which is nothing but virus-like particles as vaccines. Among all, we are discussing a lot about G proteins. Here, I want to highlight that among all viral proteins, only G protein is known to be important for immunogenicity. The G protein is the major antigen in the formation of neutralizing antibodies against rabies virus. The G protein is difficult to stabilize, but it has been successfully isolated by Cadila company, purified and stabilized by using virus-like particles technology. The recombinant rabies G vaccine is the first recombinant nanoparticles based rabies virus prepared by using virus-like particles platform. Virus-like particles are nanostructures, I have already discussed, that resembles the structure of the virus. Virus-like particles are composed of one or more structural proteins that can be arranged in several layers and can also contain a lipid outer envelope. VLPs trigger a high humoral and cellular immune response due to their repetitive structure. A key factor regarding virus-like particle safety is the lack of viral genomic material, which enhances safety during both manufacturing and administration, unlike inactivated vaccine or attenuated vaccines in particular, though very effective, but are likely to revert to a pathogenic form during manufacturing or administration, leading to adverse effects. These subunit vaccines are composed of recombinant viral proteins or purified proteins from wild-type viruses, which act as antigens, inducing the antibody response. VLPs are unable to replicate. Virus-like proteins are unable to replicate in the recipient, but stimulate the immune systems through recognition of repetitive subunits, producing a high cellular and humoral immune responses. And this is the reason the interest in VLP technology has been increasing in the recent years. Phase 3 study to evaluate immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. They had taken 800 subjects, a randomized comparative controlled multicentric study randomized comparative controlled multicentric study was done amongst 800 subjects. There were 533 subjects who were given 0-3-7 days regime of the novel Thrabies and 267 subjects were given the reference vaccine, that is Rabipur, on the day 0, 3, 7, 14 and 28 days. The efficacy, the results were the same as that of rabies vaccine, reference vaccine. So the results were about, there was non-inferiority for seroprotection. Primary endpoint day 14 and 42 were met. Test and comparator are identical in seroprotection rate, both on days 14 and 42, as was with the reference vaccine. Novel 3-dose has better safety profile, has significantly less adverse effects compared to reference vaccine. So the results are the same with 3 doses as compared to the reference doses of 5 reference vaccine of 5 doses, and at the same time the adverse effects were less as compared to reference vaccine. So the novel study conclusion, we can conclude that the novel 3-dose was non-inferior to reference vaccine, less adverse effects compared to the reference vaccine. Novel 3-dose was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. So it is much better as compared to the reference vaccine, and it has won 2 awards also in just 1 year. That was of Pharma Innovation of the Year by the Economic Times, and second award was given by the Malaysian government, the Golden Globe Tigers Award, Malaysia, for Innovative Product of the Year. It has received the Innovative Product of the Year award, and it's a real great thing. In 1 year, they have succeeded so much. I wish them all the best. Before concluding, I want to highlight some more points. Let us discuss about the contraindications. It has got very few side effects like localized pain, redness, swelling at the site of injection, and not more than that. But it should not be used, given intramuscularly. never IV, never subcutaneous or by any other route except intramuscular. Secondly, as usual, we don't give any medicine after expiry date. Drug interaction is there. For that, we should be cautious. And regarding hypersensitivity, it should not be given to those subjects who are sensitive to vaccines or the excipients of the other vaccines. So it should be avoided in those persons. But we have to weigh the seriousness of the disease. If the patient is very serious, if it has been bitten by a rabid dog, we have to give the vaccine to prevent the death of the patient, because once the rabies occurs, it will always lead to fatal. It is always fatal once it occurs. Response may be reduced in patients under immunosuppressive therapy or with congenital or acquired immunodeficiencies. Concomitant use of immunosuppressants and anti-malarial treatment after exposure should be avoided unless it is very necessary. Studies in pregnant and lactating mothers have not been conducted, so no data I could find for the pregnant and lactating mothers, but it has to be given to prevent the death of the pregnant mother or the lactating mother. It has got, and at the same time, no study was done amongst drivers and people working on machines. After effects, local pains, redness, swelling in the site of injection, and not much other complications have come across with this vaccine. Regarding, we can discuss Thravis at a glance. Thravis is first vaccine with 3 doses in regimen 0, 3, and 7. Rabies vaccine is a subunit vaccine prepared by using virus-like particles VLP platform, where nanoparticles can be engineered to elicit differentiated immune responses, increasing vaccine efficacy. Thravis available is in ready to use, no constitution required before administration. So it is very easy to use. Currently, 5-dose regimen practiced has 40% non-compliance rate as compared to Thravis, which is more convenient and more most compliant vaccine. Thravis vaccine, 3-dose vaccine, has lesser hospital visits, lesser breaks, which improves the better compliance. Results of phase 3 trials, efficacy data, the immunogenicity and safety of rabies G protein vaccine in a post-exposure immunization, 800 healthy volunteers evaluated, as we have already discussed. Phase 3 multicentric study evolved. Thravis was found to be similar to the reference vaccines for seroprotection rate at day 14 as per seroprotection criteria of WHO. So it achieves same seroprotection as compared to the reference vaccine on the 14th day. So there is no added advantage with 5-dose regime. This study also found that additional 2 doses in the reference arm on day 14 and 28 did not reflect any superiority on efficacy compared to Thravis for seroprotection at day 42. This suggests that similar efficacy of Thravis was achieved with 3 doses as compared to 5 doses of reference, as I've already discussed. The present phase 3 study results showed better seroprotection rate with Thravis G protein vaccine, 99.24%. Success rate is 99.24% as compared to published rabies vaccine data, which is only 94.6% on day 14. Regarding safety data, SABI showed a better safety profile, 9.9%, compared to reference vaccine, 17.23% in subjects who experienced the adverse events. Now we can have take-home messages. First subunit, it is the first subunit recombinant non-nanoparticle based vaccine with better immunogenicity. Secondly, it is the first vaccine with 3-dose intramuscular regime 0, 3, and 7 days against the currently available inactivated rabies virus with 5 doses intramuscular regimen over 28 days 0, 3, 7, 14, and 28 days. Secondly, it has a better compliance due to easy to follow regimen 0, 3, and 7 days. Then there are lesser visits to the doctor of the victim. Convenience, it is ready to use. No reconstitution is required in this vaccine. Thus, novel rabies G protein vaccine with 3 doses may help to address the current challenges, and therefore we can say count 1, 2, 3 and you will become rabies free. Thank you.
Thank you, sir. Thanks so much. Now, to all the eminent doctors, respected sir, if you have any question, any query regarding the novel 3-dose vaccine, regarding its administration, regarding the VLP, you can definitely ask to Arun sir. He will clarify all your queries. सर आप लोग अपना स्पीकर चालू करके पूछ सकते हैं कुछ अगर क्वेरी है तो. I think sir there is no query. I think खरे सर, ठाकुर सर, पांडे सर, even Gupta sir has also joined, I think, in between. I think there is no question has been there. No. I think query is not there, sir, regarding 3-dose vaccine. Arun sir, I will ask you that how the rabies is transmitted. Can you
Yes.
focus on some of the points so that
Well,
our
rabies is transmitted through saliva of a mammal who is already suffering from rabies. This virus is the virus is a reservoir in the mammals. Like most common are the dogs, then even cats, and most of the carnivorous animals like wolves, foxes, lions, mongooses, and cats. Even cats can cause. Then monkeys are also known to harbor rabies virus in their saliva. So, and these days monkey bites are increasing, and therefore, after monkey bites, also the patient must undergo post-exposure prophylaxis of the rabies vaccination.
I can also ask that what are the limitations of anti-rabies vaccination dose against the benefits of our novel 3-dose vaccine?
But previously, there used to be when I became a doctor, then I was having 14-day regime, and that too the injections were given subcutaneously in the abdomen, which used to be very painful. But as per the history, previously before that, even 14 doses, there used to be 31 vaccines given. I don't know the regime of that vaccine, but that was very painful and that was also very unpractical. So researches are being conducted from time to time, and the doses from 31 taper down to 14, and then they taper down to 5 doses, and the injections were 5, and they two were given in the upper arm intramuscularly. So that had become very convenient for the victimized patients. But there is, as I've already discussed, that there is dropout. People are ignorant, people are very poor, people are misinformed. So these are the three factors which limit the vaccination consumption in the rabid, in the patient bitten by animal, a zoonotic animal. So 3 doses have become very convenient. They have reduced the number of pricks because children are very they are very afraid of the doctors. So 3 doses, I think anybody can take. And then the dose being less, the cost of the vaccine will also get reduced. And then the like 3 doses anybody can afford to take.
Thank you, sir. One more question is there.
Yeah.
Doctor, if the person is bitten by the animal, then how does one can treat the animal bite?
Well, animal bite should be the first aid is that can be done any place, at any place, like at home even. It should be cleaned with running water. It should be thoroughly washed. If soap is available, then it should be washed with soap and water for at least 15 minutes so that the virus does not get over the top of the nerves. Secondly, if the dog is rabid and the bite is severe of second grade, we have already discussed the grades of the bite. So we should go for immunization immediately. And if the bite is very, very severe, then we should give rabies immunoglobulins along with vaccination and primary cleaning of the wound.
Okay, thank you, doctor. Thank you, Arun Saxena, sir.
Thank you, Mudassir.
Do you have any question, sir, regarding the rabies, anti-rabies vaccine, 3 dose, that is our novel COVID vaccine, that is our rabies. If you have any question, you can still ask Arun Saxena, sir. I think that many of the things has cleared. Yes, technical support team.
Yes.
Thank you so much, Dr. Arun Saxena, sir, for our informative talk. We truly appreciate your effort. Last but not the least, I would like to inform you that Rabies has won 2 prestigious awards in innovation category. RSVT India Pharma Award and Golden Global Tiger Award. Thank you all.
Thank you.
Thank you, technical support team. Thank you, Arun Saxena, sir. And thank you all the viewers who have joined. Thanks a lot.
Okay, you can leave now.
Okay, sir.